So the real culprits of low back pain, especially if you have a sitting job or you're stuck in the car a lot, okay? So a couple structures I want to point out. The front of your hip area, your pelvis area, and then when you kind of stick your leg out, that side bone here. Between those two is your TFL. It's called your tensor fascia lata. So when people say like, oh, I'm stretching my IT band, you're really stretching your TFL. So your TFL, your quad, because it does attach up here, and then a part of your groin, the front part of it, okay? And so think about that more at the proximal third of your thigh. And here's what happens, right? We never really sit like this. We think this is excellent posture, right? But if you think about it, like put your fingers right in the crease of your pants. If you're there and you're sitting like that, you kind of come down on your fingers, you're kind of pinching, which is kind of what you're doing to your hip joint capsule. And then what you do is you shorten the structures that are near that area. And then even if you go to stand and you go to function, all of that stuff kind of gets bunched up and shortened, and it still tilts you a little bit more that way than what you want. So imagine the stress across your low back if you have this constant moment arm of this and you feel tension, sharp pain, discomfort here. You notice you can't lie on your stomach anymore because these structures are always pulling you forward. So what can you do about that to alleviate just things that you can do at home, in the office, or whatever? Well, we just spoke about this, and this, right? And you don't necessarily have to go all the way down the leg. You can if you endeavor to later. But if you're here, number one, think about a position that's not going to be here, right? So we're kind of over exaggerating this. So everybody roll back on their tailbone, okay? Roll back to being super forward and roll back to being on your tailbone, and then roll to the middle. This, if you make that your new norm, then you don't have to worry about constantly pinching off and it reshortening, because really this is a neutral pelvic posture. You can breathe, move, very slight abdominal tension. This is optimal. But if you're there at your desk and you're not typing, you're not on a phone call or whatnot, release those structures. So you could release them with a tool, and you could kind of dig in and just hold. And if you're confused about what to do, feel tension where it's tight. Does it feel nice and spongy, or does it feel kind of ropey and hard? Same thing in the groin. You could be digging and holding. You could do lighter pressure, and you could be breaking that up. Same thing here. You could be breaking that up. So you can, if your elbows are long enough, you could feasibly dig with your elbows, drag it along a little bit, and dig in the same three structures. So now you're kind of breaking up muscle fibers and fascia, so it gives you a break. So when you stand up, you can be in more neutral by reflex. A good stretch to do. You can do a multiple ways, but it matters what you emphasize. So the reason why I like this one is if people are upright, when they go to stretch, they tend to go into this big arch. And that's the big nemesis of actually properly stretching this region. If you arch, you're doing the same thing of being tilted forward. You're not really getting what you need. But if you put your hand down and you reach back for your foot, when you go to bend into the front leg, you can't really arch your back because you're bent forward and you're bending into the front leg. Then you're getting a nice elongated stretch without arching the low back, and you should feel it all through here. Now, if you can't reach your foot and it's too annoying, you could peg your leg against a wall like this and put a leg up, and you could either work your way up to sitting up into a kneel, or if you can get there, work on tucking your butt while you're here. So you can get as close to or as far from the wall as you need regarding the flexibility of this region. But if you peg it there and you tuck your butt, then you're going to get a nice elongated stretch here. If you're doing it incorrectly, you will feel that sharp pain across your back. So that's your telltale sign. So low back pain, very much related to quads, TFL, and your groin. You can work it loose. exist in a neutral posture, and then of course work on stretching it, and you'll notice that the forward pull on your back is alleviated and that you can get some decreased tension across the low back.